Welcome to Living Chronic, the podcast that explores the realities of living with chronic illness and disability while redefining how we thrive in our personal and professional lives. I'm your host, Brandy Schantz, a disabled veteran and chronic illness warrior, here to discuss the challenges, triumphs, and untapped potential of life with a chronic condition. Before we dive in, please take a minute to hit the subscribe button on whatever platform you're listening. Now, let's change the way we think about disability together. Welcome back to Living Chronic. I'm Brandy Schantz, and I'm here today with Morgan Check, nurse practitioner and IBD patient. I'm really excited to get to talk to her. She's out there doing great advocacy work and taking care of IBD patients while also living as an IBD patient. So, welcome, Morgan.
Thank you. Thanks for having me.
So, you were diagnosed with ulcerative colitis at age 15. So, you were very young. How did that influence you to go into the medical field yourself?
So it didn't immediately sort of influence me. I went away to be like a regular liberal arts college. I actually played Division One lacrosse there, and was able to live a somewhat normal life once I started the right treatment. But once I was finished college, I was doing some research with Children's Hospital of Philadelphia, and it was quality of life research for kids going to Camp Oasis. So I went in with the forms for the kids to fill out, essentially how they felt before camp and then at the end of camp. And I went in, I volunteered as a counselor so that I could hand out these forms. And I would hang out with the medical team, kind of see, their roles, and just saw the impact that even just being a counselor could make on these kids. And it kind of got me thinking. So I came home, thought about it a little bit. Was still trying to figure out life and what was going to happen. I thought I wanted to be working with animals and things. But I ended up talking with my mentor, who I did research with, who also had ulcerative colitis. And we talked, we had coffee. We happened to be close to University of Pennsylvania campus. And essentially, my mentor, who was an NP, she was like, everything you're telling me sounds like you want to be a nurse. And essentially I think you want to be a nurse practitioner. And we went back and forth for a bit. And ultimately we walked over and picked up the paper application form for the nursing school at University of Pennsylvania, filled it out, applied to a few others as well, got into Penn, and sort of the rest is history. And I always went in with the goal of becoming an IBD pediatric nurse practitioner, and I did it. I've kind of, once I set a goal for myself, whether it's like a 5K or something bigger, like becoming a nurse practitioner in pediatric IBD, I do
Mhm.
it. So I did it.
So, for anyone who's not familiar, Camp Oasis is a camp for kids with IBD that is administered by the Crohn's Colitis Foundation. And it really is a wonderful program and a great way for kids who are living with such a difficult disease to be around other kids just like them, to feel normal, and of course, to be safe during their summer camp with counselors and doctors, people who are very familiar with their condition and able to take care of them. So I love that we get a moment to plug Camp Oasis because it's such a great opportunity for kids living with IBD. I also love that you played lacrosse through college, even though you were diagnosed with ulcerative colitis. I'm an athlete myself, and I continued doing triathlons and marathons and all the fun stuff after my Crohn's diagnosis. And I remember my GI doc, who was still to this day my favorite doctor ever. He would call me and ask me if I was watching the Olympics because Kathleen Baker just won gold, and she has Crohn's disease too, and she's out there doing her thing. So, being a pediatric nurse practitioner and an athlete yourself, how do you assuage the fears of these kids who may love doing sports, but fear that they may not be able to do it because of their IBD diagnosis?
So just to backtrack a little bit. So I was an athlete in high school, and I really blossomed going to my junior year, and was
Mhm.
being recruited actually by a few Division 1 schools for lacrosse, and that's when in season I started having bloody stool, bloody diarrhea, and then
Mhm.
immediately I wasn't the type to sort of hide it for a while. I immediately told my mom and my dad. We went to a pediatrician. We went to her husband, who was a GI, adult GI, but that was an awful sort of a whole nother story. It was pretty bad going to him. But he diagnosed me with UC, but then immediately I got to Children's Hospital where I was treated much
Mhm.
better. Um, but I went away to school. I only played actually for 2 years. It was just too much for me, kind of juggling, having chronic illness. But also I kind of just wanted to live a normal life because it was just
Mhm.
training year round. But I knew I could do it, and I guess that was I kind of needed to prove that to myself. Um, but um, it was it was hard at first because I didn't actually get on the treatment that put me into like deep remission
Mhm.
until December of my freshman year. So I went
Right.
away to college still not great. Um, which meant like training through the summer, going to college, being in preseason, lifting in the morning at 5 a.m. But I told my coach, who was super understanding. She gave me like the secret key to all the bathrooms on campus so I could like
Oh.
stop any, on any runs. I didn't, she didn't cut me any slack as far as training, but like there were things in place that sort of helped. There was a porta potty that was put by the field that everybody enjoyed, so nobody had to sneak off into the woods to go. Um, but there were accommodations made for me, which was really great,
Mhm.
so that I could be there and participate. Flying once I started Remicade, I was actually the first pediatric UC, one of them, pediatric ulcerative colitis patients to receive Remicade. Um, I was home on break, and finally I was able to get it. It was available. I then had to fly back and forth like every 8 weeks. It
Mhm.
wasn't available everywhere like it is today. So that was hard, but doable. And it made me feel really good and put me into remission. But part of being so active and scheduled and disciplined, I think, was important for my mental health too,
Yes.
and not um, sort of seeing myself as a sick person. And there's all those other benefits that I now know as an adult and being in practice for 15, 17 years, something like that. Like moving your body is great for motility. Breathing and lifting or mind breath to movement like yoga is important for vagal nerve stimulation, which brings
Mhm.
your stress levels down. I didn't know that then, but it was certainly helpful,
Yes.
with the rigors of academics and things like that. um, but now, moving forward, I still keep that athlete mindset. Even I had surgery last year to kind of revised my J pouch a little bit. And I was in the hospital for a month, but coming out of it, there was a 5K that I was raising money for, Connecting to Cure, which is a Crohn's colitis group that a family started out here. And I kept saying, okay, I got to make it. It was a year ago today that I think I was discharged roughly, and there was a 5K in October. And I was like, that's my goal. My rehab is going to be getting ready for this 5K in October. And it was great. It was such a great goal. It kept me moving, starting from scratch, but moving in that direction.
Mhm.
So having that mindset, that athlete, that training mindset has just really helped me along with all the bumps in the road that come with this illness. And I share that with my families that I take care of, how important that is. Movement at any level, walking,
Right.
stretching, all of that.
You're right. It's so much of a help to your mental health, and it is such a help to your physical health as well. I think the assumption is once you become sick with anything, especially something like IBD, that, okay, I just can't go out and do these things anymore. But once you get an accommodation, it does so much to help your body. And I've always said that I can tell when my Crohn's is so poor that I can't exercise because everything else starts getting worse with it. The infections get worse, the illnesses get worse, the pain gets worse.
Mhm.
there's definitely something to being able to move, to being able to keep you healthy in other ways. So I love that you talk about exercise and how to move your body and how to stimulate that vagal nerve and breathe and do all of these things. It's so, so helpful. Even if you're not doing it at, an elite level or a collegiate level, because of course, you know, collegiate sports are wonderful for keeping you in school and not partying too much, but they are they are very taxing to say the least. Now you're working with these IBD patients. I mean, that's so wonderful to be able to help kids just like you were going through such a difficult time in life. You talked about missing your graduation due to your illness. How do you think some of these small things that so many of us take for granted
Mhm.
affect kids who are diagnosed with Crohn's or colitis?
Yeah, it was my second bachelor's because I did an accelerated program at Penn, so I missed my nursing school graduation. I was in the hospital flaring, and it it's definitely I can empathize with them, on so many levels. Um, I think there's a certain bit of me that maybe I know in the pediatric world and in the nursing world, there's a holistic sort of way of thinking. So we try to accommodate, especially those kids when they're missing things, or if we can get them a pass if they want to go to Disney, or if they are have plans. I remember when I first started at Cedars, I was just I was amazed at the accommodations I was helping kids with or young adults with. One patient had tickets to go to Coachella, and the patient was so sick. And I was talking to the doctor. I said, "Are you sure we want to do this?" And they were like, we have to help them as much as possible to live out these goals and things like that. And if it's safe, um, we can, make sure that, they have IV fluids and they can take some Gatorade, whatever they were doing to get there in a safe way, let's try our best. So, writing
Mhm.
notes and letters and things and helping with all those accommodations and, testing accommodations and free bathroom pass accommodations and more than that too, but the just small examples of just making childhood, young adulthood, those things a little bit normal and providing accommodations and passes and everything that's needed just to make it a little bit easier, um, so that life is as normal as it gets,
Mm.
and they're not missing out
Norm
on those big things.
Yeah,
Um,
normal's important, even little things.
yeah.
Even little things. I've told people, I strangely enough, I miss the normalcy of just getting up each and every morning and going to work and maybe even just hating my boss. Just normal people stuff, just that normal little stuff because so much of my life has changed and so many days I can't go to work. And
Yeah.
I ended up starting a business to be able to work through all of my illnesses. And, when you're your own boss, that sounds lovely until you realize that you're in charge of everything. And if everybody else is off work, you're still working. So, so many little things that are so important in life. And if you've never dealt with a chronic illness, you just don't think about how great it is to really just get up in the morning and go to work and maybe even hate your boss a little bit or have to stay late and not have anything to worry about other than maybe ensuring somebody can pick up the kids from daycare or catching the late train or whatever it is that you would have to do to
Mhm,
work 2 or 3 hours late. And those are the little things that I think you start to recognize when you've been sick for a long time.
mhm. And there's a lot of advocacy and speaking out for our patients that we have to do, our older patients that are
Mm,
off to work, like you said,
yeah.
and their bosses, their supervisors don't understand how this illness impacts them in so many ways. They feel like, oh, it's just
Hmm.
a bellyache. Oh, you know, she's just utilizing this to get out of all these things. And we've had to
Right.
help. provide legal documentation, and it's gotten escalated and escalated in several cases because, it's they don't want to hear that they have this essentially disabled. We're disabled people. Like we
Right.
qualify for those accommodations, and they don't want to deal with it. So we help them get plugged into legal lawyers and stuff, helping to provide the documentation for that so they can
Yes.
take that next level because they don't want to hear it. Even teachers and principals, I'll have to make a phone call and explain that this isn't just a tummy ache. This is a lifelong
Right.
autoimmune disease that will affect them in many ways and may not. And especially you don't see it on the outside. These kids, and they're very good at also presenting with a smile
Mhm.
throughout the hardest days and the most pain and that sort of thing.
Yeah. I think the point that most people are most shocked to find out when I talk about my own Crohn's disease and how it's affected me is there's just no one set treatment that has a set timeline and a
Mhm,
set termination, and then you move on with life. We hear about serious illness, and most people immediately think cancer when you say serious illness. And cancers, while each one is treated differently and there's a lot of different components to it, I think a lot of people think about that in terms of okay, there's this set treatment. Maybe there's radiation, maybe there's chemotherapy. It's done for X number of weeks. You ring a bell, you're back at work, short term disability over. And
mhm,
when I explain to people that I never experienced symptom free remission until I started Stelara, and then at the 8-week mark on the dot, I suddenly found myself in symptom free remission for the first time in 10 years. They look at me like I'm crazy. But that's the reality of IBD. And that's that added layer because we can't just go to the hospital, get a note from work that says, okay, 6 weeks of heavy steroids followed by the one treatment that cures all for all IBD patients, and she'll be back at work. We have to trial and error and see what may or may not work. We have to give it time. We have
mhm,
to test different things. And for many people, they just still haven't, there isn't a treatment available right now that's going to get them into symptom free remission. Now, there's a lot more at our disposal today than there was 10 years, 20 years, 30 years ago. So thank goodness for that. We're really living in a much better day to have IBD than 20, 30 years ago. But that's the reality. And that's what's so difficult to explain to that boss or that parent, even, or
mhm.
significant other, whoever it may be. Okay, I know we now know that this person is sick, but we just don't have a set timeline. I don't know when you're going to get your worker, loved one, child, spouse back as they once were.
That's very true. And it's such an unpredictable illness that
Yeah.
you could be in deep remission, but
Hmm.
you get food poisoning, and that easily throws your flora off. And now
Hmm.
you've got SIBO or IBS, small intestinal bacterial overgrowth, or IBS, and
Hmm.
that pain and discomfort and irritation is so severe that you need um, you know heavy treatment. You need your antibiotics. You might end up with some motility issues. You might need a tube to drain, your stomach because your motility is totally shut down. There's all these other complications and nuances that aren't directly IBD, but they're related and sort of falling out from that, the process, the disease, just the underlying
Hmm.
everything going on in your GI tract of it not being quote unquote normal. Um, so I find it so hard to fill out the FMLA paperwork because it's always asking for our patients, like, what are the treatment days? Like, how often will they be? I was like, it's a very unpredictable illness. You just don't know. Like,
Right.
it's not a pregnancy. It's it's like very difficult.
Yes. Yes. It could be any time. I would love to know too. I would love to know. It is difficult. And of course, with IBD, like many autoimmune diseases, because Crohn's disease and ulcerative colitis are autoimmune diseases, there are other autoimmune diseases that often like to just kind of come along for the ride, right?
Very true.
So maybe your patient has IBD, but they also have rheumatoid arthritis, or they might be
Yes.
dealing with lupus. So, we always have a lot to take into consideration when we're looking at this big picture.
Yes. There's a lot to unpack, and there's a lot of mental health component to it. And I always
Mm,
encourage, patients and families, is early on to seek out help, and not just mom and dad, but somebody that doesn't have any, you know, stakes in it, just like an
hmm
unbiased person, whether it's a school counselor or, somebody talk therapy, counselor, or sometimes we need pharmacological agents. So we need a psychiatrist, because actually, when you have any sort of illness in your GI tract, it's going to directly affect how your serotonin's produced. It affects all of that gut bacteria that affects your mental health because of that vagus nerve connection. That
hmm
it's just so interwoven. And then anyone who's had surgeries or bowel resections or anything like that, there's a lot of mental health issues just directly related to your gastric flora, just to the bacteria that are in there.
Yeah.
And there's that's not my specialty, but I'm learning more and more about it every day. It's pretty amazing how connected that is. Mhm.
Well, and speaking of connected, um, I know I've learned the hard way in recent years that your hormones are very connected to so many of these diseases. I'm
Mhm.
living in absolute middle-aged woman hell with perimenopause and, trying to get to the end of, I don't there is no seemingly end to menopause. It's just one big giant like 10 to 20 years of just nonsense in your life, I think. And my dysautonomia flares, the POTS is a mess, my Crohn's disease has its own little mess. It's really so difficult, and there's just not a lot of information that women like myself are able to find because nobody's really taken much time to study this in depth.
Mhm.
All I know is when I'm in my groups, me and all the other women, somewhere around the ages of 40 to 55, are losing our minds because it's so difficult. And you are going to be featured at an IBD Women's Health Conference coming up September
Yeah,
13th, tackling
that's
hormones, healing, and finding breakthroughs. I love that because this is so much more than just simple, I have IBD, I have this or that. So let's talk women's health. Tell me about the
yes,
conference.
yes. So I actually was chatting with Dr. Pooja Khanna. She is my IBD doctor and a colleague. Um, and she's head of the Women's IBD Health Program. And it's so important, if possible. I know all over the country it's not always available, but if you are a woman, it's great to get plugged in with a program that has a women's IBD doctor, because there's so many nuances, like you said, through stages of life. And especially when I got plugged into our program when I was um, freezing my eggs. I was, whatever, 35, 36, 37. I was thinking about it, didn't have a partner. My OBGYN said, it's time, you should be doing this,
Yeah.
if you don't have kids. So I started that, but I started plugging in we have this women's health program, where you talk to like a geneticist, um, high risk pregnancy doc, and you talk to everybody and they evaluate all the meds you're on, what you need to stop, what's okay for egg freezing, all of that during the whole process. Um, because there's meds that most IBD meds are actually perfectly safe to take. I mean, there's very few exceptions, but it's just so important. Then, like you said, as the stages go on, pregnancy, it's important to follow up. It's high risk to have baby while you have IBD, but it's safe if you're in remission, and the goal is to be in remission when you get pregnant, like you plan it out. And then, post pregnancy, sometimes you can have those crazy fluctuations. I had to change my medication post pregnancy because my Stelara was no longer working. I'm on Skyrizi. It's fantastic. And then perimenopause, yay. And then
hmm
menopause. everything changes. So medications have to change. How you're cared for has to change. The questions they ask change. So this is our first IBD and Women's Health Conference. It's going to be in person only because the goal was for everyone that lives in the area not to be logging in from home. So we want people to
Right.
come in if possible. I'll share as much as I can, social media wise. Definitely be posting, but we want to meet as many people as possible and tell them what we're all about. There's going to be a dietitian. There's going to be one for like a whole section for providers to be learning, and then there's going to be a section for patients. And I'll be sitting on one of the patient panels as a patient, kind of who's been through all of it. So I'll be there answering any sort of question. I'm an open book, really. It's like anyone can DM me kind of anything within reason. Like, but I share a lot about because I just want to help, really. I just want to help.
Hmm.
And there's going to be, I mean, I'm looking at the lineup is amazing. And we're going to have a couple psychiatrists there that are at Cedars. Um, it's going to be an amazing day. There's going to be lunch. And then it's Dr. Abreu. She's our new executive director. She's very interested in women's health, even, some IBD prevention. So we're hopefully going to be having some studies coming up where we prevent IBD in neonates. So kind of adjusting mom's microbiome by what she eats. So the babies, which is very interesting for me. But gosh, I keep going on and on, but it's going to be a
No, it's so
very
exciting.
great day for anyone who's in the LA area. I'm at in Los Angeles. I work at Cedar Sinai. So if anyone can even a couple hours drive, like it's just going to be worth it. There's lots of places to stay in the area. There's hotels that offer discounts for people that are coming to Cedars. But if you have any questions, you can always, DM me on Instagram. I'm very active. Um, but I would love to meet anyone who wants to come um, in person. And then in the future, I think we're going to open it up and have some ways to log in remotely. But I'm going to share as much as I can. Um, it's just this is the really the first of its kind. In I think in California at least, this whole hormone and women's health with the IBD together, like a whole day of it. Usually at conferences, it's just like this little tiny portion,
Right.
but it's a whole day, like an entire day. What is it, 7:30 to 4:40? So it's going to be juicy, a lot of stuff.
I'm excited. I can't wait to learn more. And of course, you'll be sharing this on your Instagram page, which I'm going to put
Yes,
in the notes also, of course. But it's Morgan Check NP, right?
it's Morgan
So I'm
Check
check
Gastro
gas
NP.
in.
Gastro NP. And yep, follow along. I like to drop some like clinical pearls, some fun stuff. My kid's always on there because I'm obsessed with him, of
Mhm.
course. Um, but I'm always feel free to reach out. I'm very accessible. I don't have a million followers. Um, but this can be a little tricky. There's one of these QR codes, but it's set up for they set it up for that it's more for providers signing up for like CME. So if you're having a hard
Mhm.
time you sign up, just DM me and I will sign you up. Seriously, like I will do it. I want people to come and learn. It's going to be such an amazing day.
It's really exciting. I'm definitely going to be checking in because there's just so much to learn and understand. And I mean, if you're a woman with IBD, you're looking to get pregnant, you're going through perimenopause or menopause, or you're young and just diagnosed and going through puberty. I
Mm,
I mean, these are they're so difficult. Each time period brings its own challenges. So to have a conference like this really focused on women and what we are experiencing, I think it's amazing.
it's gonna be groundbreaking, and I know like some other groups are gonna be putting on theirs after we do ours. So we're
Well,
definitely starting something. So it's
yes,
good.
please. Can we take this on the road? Crohn's Colitis
Yep.
Foundation. Can we? I mean, I'd love to have this as a road show. We need this in DC. I'll be signing up.
I'm sure
Yesterday.
there'll be a practice out there, following suit because it's needed.
Yeah, absolutely. And of
Mhm.
course, on your Instagram as well, I hope everybody checks you out. You talk about movement and exercise also. And I just think that's so important. Even little things, people don't talk enough about breathing exercises. It's changed my life. Yoga and breathing exercises. it really makes a difference.
100%. And, nothing breaks my heart more than hearing people not getting their meds, approved, stopping medication during pregnancy because nobody told them to keep doing, anything like
Yeah.
that. But like, for example, somebody couldn't get their Humira renewed and I saw it and I was like, oh my gosh, let me help you. Like, I help probably more than I should, but I get frustrated when people aren't getting the level of service that we provide at our clinic, like people writing appeal letters that are strongly worded or anything like that.
Hmm.
I'm always sort of willing to help as much as possible, and I don't have, like I said, a billion people asking me for things as of yet, but I do try to help as much as possible. So if things aren't happening for you, that's where it comes in. Like I do like to advocate and just kind of help things move along for as many people as possible or point them in the right direction. So that's sort of my service for our community.
And that's true heroes work. I don't know how
Mhm.
to get it through to all parties involved, lawmakers, insurance companies, hospitals, everybody involved. Healthy patients are working patients, which are good for the economy.
Yes.
This is a no-brainer, everybody. This is a no-brainer. Keep us healthy.
Yes.
Well, thank you so much for being here, Morgan. I'm so excited that we did this because you share so much great information. I'm looking forward to learning more from you on Instagrams. But big thank you.
Thank you so much for reaching out and connecting with me. It's been a real pleasure.
That's a wrap for this episode of Living Chronic. I hope today's conversation gave you insight, inspiration, or at least a little reassurance that you're not alone on this journey. Living with a chronic illness or disability comes with its challenges, but it also comes with strength, resilience, and a community that understands. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who might need to hear it. You could follow me on Instagram at Chronically Brandy Schantz, other socials at Brandy Schantz, or my website at brandyschantz.com for more discussions, advocacy updates, and everyday strategies for thriving with a chronic illness. And if you have a topic you'd like to hear about, send me a message. I'd love to hear from you. Until next time, keep pushing forward, keep advocating for yourself, and remember, you are more than your diagnosis. You are powerful, you are unstoppable. Thanks for listening to Living Chronic. See you next time.